Hi everyone, this is Lindsay. Just give us a few minutes. Our presenter may be having some technical issues, so just hang tight, okay?
All right, thanks. Bye.
All right, welcome everyone. My name is Lindsay Novacek. I am the chair of the nursing section of the North Carolina Public Health Association. It is my pleasure and my honor to introduce to you today Dr. Sean Knipe. Dr. Sean Knipe is currently a professor in the School of Nursing and an adjunct faculty member in the Gilling School of Global Public Health at the University of North Carolina at Chapel Hill. Her program of research focuses on the social, policy, and economic determinants that impact the health of disadvantaged populations in relation to welfare policy, employment, unemployment, low-wage work, women's health, and chronic disease self-management. Her studies have been grounded in community-engaged methods and supported by the National Institutes of Health and the Centers for Disease Control and Prevention. She has published widely on issues related to public health nursing, social justice, and nursing science. She currently serves as chair for the Public Health Nursing section of the American Public Health Association, and we are so excited to hear her present today. So thank you for joining us.
Thank you, Lindsay. I'm really happy to be here. Can you hear me? Yes, great. Okay, I couldn't see your thumbs up. The screens are like moving around a little bit. So I am very happy to be here with all of you in North Carolina and all my public health nursing peeps who are out there doing all the tough work that this pandemic is demanding of you. But I want to say that I am very proud to be part of this group, and every day I think about how all of us are really rising to the challenge of this. So I thank you on behalf of all of the nurses who are part of our section of the American Public Health Association, all the citizens of North Carolina, those who would also thank you and those who would not, because you are just doing an enormous service for our state. What I'm going to talk with you about today, I guess I would say, let me ask a couple of questions first. Lindsay, do you want to take questions or are you wanting to hold them?
So if you have questions for Dr. Knight, please just put them in the chat box and I'll monitor throughout. And then we'll take some time for questions at the end out to her.
Okay, thanks. I'm very open to fielding questions as they come up while we're on a topic. If you spot something in the chat box, Lindsay, that you think we should kind of halt and talk about a little bit more. Yeah, great. What I am going to talk with you about today is how our advocacy efforts, we hope, are positively impacting the future of public health nursing in the nation and in the state. COVID-19 sent all of us into, a vortex that we didn't expect to be in. And so much of what I'm going to talk about in terms of advocacy efforts, we refocused our energies on that and what was going on, and trying to make sure that public health nursing got the support that it needed at the national level and the attention that it has absolutely earned at the national level. So if you can advance the slide next, Lindsay, unless I don't have control to do that, right?
I'll do it. Yeah, just tell me that. I'll push the button.
Okay, good. I just want to make sure. This is a new and different platform for me. So I have somewhat of a structure to this talk, and I'm going to provide, for those of you who might be a little less familiar with APHA in the public health nursing section, I'm going to provide just an overview of that, like what that looks like on the ground every day. Talk a little bit about our North Carolina affiliates, review with you the public health nursing section leadership structure, and kind of point to ways where you can all get involved and where we would love for you to be involved. And advocacy review and update, talk with you, kind of walk you through what the protocols are of APHA as an organization, and then share with you some very specific initiatives that we've been involved in this year that have taken the bulk of our time. Those include things revolving around Robert Wood Johnson Foundation, Public Health Nursing and Social Determinants of Health. There's a lot going on there with the Future of Nursing 2020 and 2030 report. COVID-19, which sent everyone's world upside down. And we refocused all of our efforts on the nursing coalition community and the CARES Act, and we have engaged ANA in ways that I think we haven't done in a while. So that was a very good thing to do. And then racism, police violence, and border camps we've been involved in. Let me just say 2020 has brought no shortage of things for us to be advocates about. In fact, we find ourselves, I think the leadership team finds itself frequently in the unfortunate position of having to really prioritize because of limited time and energy and too many issues to address. So so that's a call and a cue to all of you on the call to join up if you're not already engaged and involved. We need you. Next. Okay. So APHA is the oldest public health organization in the US, founded in 1872. It's a 501c3 organization. So with that come some restrictions in terms of advocacy and what we can do around advocacy, which I will talk about a little bit later. There are about 25,000 members. There are many, many sections. If you have been familiar before with APHA, you might know that. Most are public health disciplines or programs. And we are one of the 32 sections, the student assembly, and then I didn't finish the slide here. I guess I was going to add to that list. Can you, Lindsay, is there any way to poll to see how many people have been, like, out of the group that's here? It looks like there are 42 people here, I think.
We can't create a poll in this session.
Okay.
And just ask people to drop in the chat box if you just like to ask them a question.
Okay. I'm curious how many of you have been involved in the public health nursing section of APHA in the past. So if we can, we're getting some hands up, like in the chat box, which is great, and some not yet. And so for those of you who are not yet, I hope that that's a soon to be, and we would love to have you. So, okay, lots to do. It's an enormous organization, I guess. And one of the things that I talk about, well, let me go back to the slide. Public health nursing has its own site, its own section site within the APHA website. So you can go to that and peruse around. There are many things on that are resources that that guide public health nursing that the section members have been involved in. So you might want to take a look at that. One of the things that I frequently talk to people about, and this is not entirely unique to academia, but I know that it's kind of a dominant theme in academia, is, you know, we all have to sort of pick and choose where we spend our time and energy and money, frankly, in terms of belonging to professional organizations. It's quite expensive to do that, and none of us really have time. We're all very busy people. And so I'm frequently tapped on the shoulder by nurse colleagues who want me more involved in the academy, for example, or other kinds of organizations, ANA, and the bottom line for me kind of always goes back to, what are the values of this organization and how do they demonstrate those values in ways that are important to me? And one of the things that I would say that's most important to me is speaking for health, essentially, and being not relenting in how you do that, being first to do that, and not looking around the room to see who's going to say something first, and then joining on the bandwagon, but really sort of charting the path with the wagon, if you will. So I think APHA does that, and that is why I have, decided to invest my time and energy into this organization. I see them first, front and center, speaking out against things that are not right, that compromise health, and there's no hesitation, there's no hedging to see what the political consequences might be of that. They say what needs to be said. So that's my personal feelings about APHA, and I have really appreciated that. Next. So we do have a large group of affiliates. There are 53 state and regional public health association affiliates, and there's a council of affiliates who get together and more from the practice and boots on the ground sort of end of things in each state, get together and direct the affairs of those groups. It really, the regional partners really provides a network for action, if you will. It's kind of like a direct path to practice settings where we might need to get word out, or might need to get information about what's going on. Affiliate network is a very strong and very important one. Next. Uh-oh, these didn't come through. Well, let me just say, I hope some of the other slides do, or we might have to figure out how to screen share kind of really quickly, Lindsay, or move to the PDF files or something like that. So your fearless leader, Dr. Susan Little, the red arrows in the empty boxes there are pictures of her with us at APHA last year. They're very good and sweet pictures of her just having fun at APHA and being a real advocate for North Carolina public health nurses. So we are really, in terms of our state, we are really well represented in national endeavors at APHA. There have been a long line of people in leadership positions. Susan's laughing at this. It's the picture, Susan, is there were three of us, hear no evil, see no evil, speak no evil. We were doing that, and it was a fun picture. But North Carolina is really well represented. We've had, yeah, there we go. Thanks, Lindsay. I can work off of these. That would be just fine too, if you want to do that. We've had a long line of leadership in the public health, leading public health nursing section from North Carolina. Sonda Openwall is on the call. I see she was the chair for some time in the recent past. Beth Lamanna has been chair. So we have a long, proud sort of history there, and I think people look to North Carolina to be leaders, actually. I hear that a lot. So our leader here in North Carolina is the section secretary-elect. She's worked on the ANA scope and standards for PHNs. She's been heavily involved in rewriting the public health nursing competencies with the CPHNO, and I'll tell you more about what that is in a minute if you don't know. She makes all of us look good in North Carolina, and she makes us really, really proud. So I am absolutely thrilled every single day I get to work with her and talk with her. And she is part of my 609 squad, which I'll have to ask her what that's all about. Next. Great. So this is a little bit small, but this is our section leadership structure. We have a section council that's comprised of essentially people who are elected into positions, and this is basically our voting membership here for the section. So this is the group that weighs in on decisions. However, the section has many committees, many members, and definitely they give their opinions and contribute to the discussion and the dialogue and the debate sometimes, and really kind of sway whether the section goes in one direction or another. So this is just for our section. I haven't really given you a structure of APHA overall, but I'll talk a little bit about that. There is a governing council of APHA. Think about that kind of like the Senate, if you will, where each, or I guess it's more like the House, because the number of representatives you have is dependent on the number, your membership size. But the governing counselors represent the sections, and at each annual meeting each year, there are 2 days really of deliberations by the governing counselors to pass policy statements and determine what the policies of the organization will be, elect leadership at the APHA level. So our governing counselors are heavily involved in that. We rely on them to do the voting, which is the will of the section, and to come back to us and talk with us about issues that might be controversial, or things that they want input on. And so being a governing counselor, I guess I would say, I was a governing counselor for 3 years, and it was really interesting. In that role, I was a governing counselor and I was part of the science board of APHA. And in those 2 roles, I really that was the first time that I really understood what sort of the inner workings of APHA were all about. And I guess in a nutshell, a large part of the membership involvement evolves around developing and passing policy statements. These are pretty detailed, heavily vetted statements that are made public, and these statements are then taken up by everyone in APHA, but in particular the executive director, to make policy change. So to use these policies as sort of stepping off points for advocacy and bringing our policies to congressional representatives, for example. So it's really a hard thing to write these policies, and they have a long and very scrutinized path before they're actually voted on, or before they are approved and then made part of APHA's historical and public record. So a lot of activity in that regard. And all of those are available on the APHA website if anybody has an interest and wants to see like what kind of policies do we write about. There are I want to say like hundreds of them. There are a lot. Next. Okay, so we also have committees, and this is a list of just some of the committees, or actually this is a pretty comprehensive list of our committees here, now that we can see the whole slide. So we have just this year changed our structure for committees, where Each one will have a chair and a co-chair. The terms are for 2 years. And they all have various roles and jobs and focal areas, some of which have to do with kind of keeping things going and keeping opportunities available for members during the year, and others like local arrangements, for example. Those are the folks who really plan and coordinate all the things that are going on for the annual meeting. So within each of these committees, I will say, if you're looking for a way to be involved in APHA, this is a great start. Not necessarily as chair, or maybe chair-elect though, because you'll have a 2-year learning tenure, right? So there's a learning curve with all of this, but you'll have 2 years of, you know, being watching the chair and being able to model off of their actions and what they do. So, and then there are members. So then, you know, there are just a lot of members of each committee who offer to help out the chair or the co-chair or take on certain tasks. So we are always looking for people to get involved with this. We are literally about a week away from sending out a mass communication. If you happen to be a public health nursing section member, asking for people to put their names forward for some of the committee chair and chair-elect positions. And then there's a much more simple process if you want to get involved in other ways, which can just be even emailing me or emailing Dr. Little, and she'll forward this on up. So lots of opportunities here, and I just wanted everybody to see that. Next. Okay, so some of these things we've already talked about. The policy resolutions are really the major advocacy platform that is part of APHA. There are many advocacy trainings year-round. This video in the lower corner, we don't have to play it, Lindsay, but I did put it in there with the URL as a link. That's an advocacy training kind of video that you can access anytime you want to. And that's actually right on the APHA website as well. And APHA, they also have an action board. And what the action board does is it's responsible for taking the policies that are approved and turning them into actionable things. Taking the information in the policy and moving it forward in a very practical kind of way, and how to implement that policy. There's Speak for Health, and that is a really great grassroots kind of way to get involved. I mean, the APHA makes it very easy to have your voice out there. They'll put out action alerts and Speak for Health sort of templates, forms that you can put your name into and forward it on up to your representative. And they've made it very easy and streamlined, just kind of understanding that people have not a lot of time. And because it is a 501c3, APHA has to focus on issues, legislative issues, or policy proposals, not political candidates. So there can't be lobbying of any sort per se, but we can inform and educate as to what the issues are. And so in addition to what I kind of refer to as APHA's integrity or moral compass, it's also very heavily science-based. It is evidence-based, and nothing gets in that policy proposal if there's not sound evidence to back it up. So I think that's another real strength. And they want to make sure that when they are taking this policy to Speaker Pelosi's office, that there's substance behind it in terms of evidence and data, and that's great. And then there are leadership calls that APHA has with the leaderships of members of each section, where they update them on congressional things that are happening and things that they think could impact public health down the road, to kind of alert us. They will use those calls to sometimes mobilize certain sections to get engaged in issues. And so they have a really robust system, I guess, for policy and advocacy, and it's really pretty impressive when you see it in action. Next. So one of the things that I'm learning, and I think I could be potentially giving some of the APHA staff a heart attack at times when I ask all of these questions, like, can we sign on to this, or can I? What are my limits here in terms of what I can say to advocate for this thing or that thing? And I think I've probably had the director of government relations on edge more than once, but I don't do things rogue. I always go through that person and ask about it, but they have a pretty serious system for doing that. So your section chair cannot be rogue and just go off and say things or do things whatever you want to. You need permission and approval from APHA for a number of things that could be public. And part of that is to protect their 501c3 status, and I get that. And I think they're very aware of public perception of what they stand for, and I think they want to be clear about the stances that they take, and they want to definitely know what their section chairs are doing, so that if they get called about a statement somebody made, then they already know about it. There's a really rapid response turnaround. I can literally contact Don Hopper. He's the director of government relations, and within an hour, I'll have an answer sometimes. So he's on it. We've also we often ask for their approval for things, but the other thing that we do is we ask for their support sometimes. Sometimes issues are so big that we feel like it would be a good thing if we had an APHA endorsement, not just the public health nursing section, but the entirety of the organization stand behind something. And so there have been times this year that we've engaged them and asked them to sign on to a letter or a statement or something like that. Next. Okay, so there has been a lot of activity this year. I think if you've ever been involved in the public health nursing section and then kind of, gotten out of it a little bit, you will have missed this hiccup in one of the organizations that we've worked with a lot for a long time. You might recognize it by another name, or the Quad Council Coalition. And there was, so the Council of Public Health Nursing Organizations used to be the Quad Council, where there were 4 quad, get it, you get that, quad, public health related nursing organizations who work together to kind of be a larger, stronger voice. As we have expanded, including bringing ANA on board with us, which has been a real strength, and that just happened this past year, in the Rural Nurse organization, and I think we're courting a couple of other organizations still, but we're part of that. Our section is part of that, and we actually take a pretty hefty lead on many things in the CPHNO. But whatever you see now that CPHNO, that is what had been the Quad Council. Sometimes I think the lines between these things get blurry, but there are times when we consult with, when something I might want to do, for example, I will, if I think we need more brain power or effort, or more people to come together to actually do something. Sometimes I'll take it to the CPHNO and see if we can partner with some people in these other organizations to kind of get the job done. And sometimes there's some other advantages to kind of being one in this pool of organizations as opposed to the organization trying to make a public statement. One of those advantages is that we do not have to have approval for statements we might want to make public through CPHNO. We don't have to ask permission for that through the public health nursing section, because it's not just representing the public health nursing section. We can also, post those in very public places. We have a lot more control over the public access of that, and the process and what goes into it. And sometimes it makes a stronger statement when you see that this is a coalition of, many, many public health specific organizations, with perhaps the exception of ANA, but that being our primary professional organization. So we do a lot with them, and there are opportunities to work with them and be a part of that through our section, I would say. Next. So here's another group that we work with a lot, and this is the Nursing Community Coalition. This is a group of 63 member nursing organizations. So this, in contrast to the CPHNO, this is not public health specific. This is pretty much every imaginable nursing organization that you can think of. A very long list of folks here. But the Nursing Community Coalition, I believe that this is launched through, it has an affiliation, a relationship with AACN, I believe. But this is a great group of people. This is probably, has come to be as strong a voice as maybe ANA, I would dare say, in terms of what gets sent to our congressional representatives, what gets considered, what gets entered into testimony, for example, at congressional hearings and things like that. It's worth going onto their website and taking a look at what's there. I have enjoyed working with the folks who are there, and public health nurses are very, very engaged. You do need to pay for membership to belong to this. It's not a lot of money, but it is a paid membership to support the efforts. So our section feels like that's money well spent. And I would agree. I'll show you a couple examples of what we've done with them as we move forward a little bit. Okay, next. I guess I'll stop here and just say, like, ask if, well, let me finish this one, and then we'll stop for some questions, because then I'm getting into some of the specifics of what this section has done. The other things going on within APHA, like, if nothing else, the last several years have you know, I think our public health colleagues have felt like we just can't respond fast enough to all of the things happening around us. And what has become sort of painfully evident is that we don't have a way to rapidly respond to things. So a great example of this was when a great example of this is when I want to say July 2019, maybe 2018, I can't remember now, but you know, there were reports of children being separated at the border and what's happening in the migrant detention camps. And many people in our section actually wanted to write something about that, wanted us to take a stand and make a statement. And I was all for that too. And we were trying to mobilize people, but it's really hard to do that when, if everything has to be based on evidence, you need people who know that literature. You need people who can, off the top of their head, like, oh yeah, I know where to go for facts and data and whatnot. And we didn't really have that. And when we got together in 2019 at the APHA annual meeting, we actually heard the same thing from other people in other sections, that like they were struggling in the very same way. So the larger APHA group is right now trying to figure out a way to kind of develop this rapid response network so we could quickly mobilize, not spin our wheels trying to figure out who knows enough to put on a team to do the writing of this, or do the phone calling, or do the networking, or whatever it is, that there would be kind of a more efficient mechanism to do that. There's a big analysis going on right now to figure out how to streamline things. What we did in the interim, while we're waiting kind of for the findings of that and for the fruit of that to that labor to kind of be available, is we generated a database of our members, their expertise and their willingness to lead advocacy efforts. So we have a small database. I want to say there are 53 people in there, something like that, but that's a great start. So we can tap that when we need to, and use that in some ways. Next. Okay. So here's where I really start talking about what we've done. That's very specific to public health nursing. I think I'm going to pause here and just see if people have any questions, or if there's anything you want to talk about before I kind of launch into the nitty-gritty of what our section has done.
I just see some comments from people who are involved with the APH and nursing section, saying it's a wonderful way to get involved and to network with others across the country with a growth mindset.
Yeah, I would agree. It's a great group of people. I mean, everybody on this call knows that public health nurses are great. And this is just like a bigger, great group. So, okay. If there's nobody, I don't see any more kind of being generated here. So we'll go on. There might be some after we talk about this. So one of our major initiatives, and if you are, this is kind of a spoiler alert. If you are attending the session that Lisa Campbell and I are doing at APHA, a lot of this is is you're going to see repeated, where we talk about, we're going to present exactly this, what the nursing section has done with regard to the Robert Wood Johnson Foundation Future of Nursing 2020-2030 report. So I wish there was a way to raise hands or something like that. If you can just enter in the chat box, like if you're aware of this report, that it's going on or not, like just put a yes, or just if you could just like add a yes or a no, I'd be really curious just to see. Lots of yeses. Lots of yeses. Mostly all yeses. I'm looking for some no's though here. Not a single no. So it could be true that everyone, they're being quiet. Okay, good. Good. I'm glad there are some no's because great. Okay, good. There's a lot going on in this regard. And I think the most important thing to know is that the section sort of has your back here. And that's part of, I think, the point of the section. So you probably, many of you who are saying no, you don't know about the Future of Nursing 2020-2030 report might know about the 2010 report that was released by the Robert Wood Johnson Foundation and the Institute of Medicine. And that report was the Future of Nursing, Leading Change, Advancing Health. So in that report, when you go back and you look at that, there were several recommendations made for nursing in it. A lot of it had to do with education level, practicing at the full scope of your practice, removing barriers, increasing diversity, etc. There wasn't a lot at all around public health nursing at all in that report. And when you go back and you actually look at that process, the process that was used to generate that report, there wasn't a lot of opportunity for public input. There is opportunity for public input, but not a lot of it. And I'm not sure how, if at all, public health nursing voices were a large or in any meaningful way heard in that report, I guess I would say. Most of the meetings were closed. There were 8 recommendations that I mentioned, including one that emphasized expanding nursing care in communities. And so I think it sort of begged a question, how can you propose doing that and not mention really or support the public health nursing workforce, which is predominantly the workforce that will do that. So I think there were a lot of questions after that report was released, and shortly, the result of that report, the recommendation uptake was pretty extensive. It's driven a whole number of other subsequent initiatives involving nursing and really directed the direction of our discipline. So it's not these initiatives are not inconsequential, is I guess what I would say. Next. So the next iteration, the next report that Robert Wood Johnson is working on is the Future of Nursing 2020-2030. I'm going to give you a little bit of context around what this is, this report, and how it's different from the 2010 report. It was launched in 2019, and The point of this report is really to emphasize what nursing's role is in addressing health equity. And it doesn't say this explicitly, but it is everywhere in the discussion and in the intent of this report and how to address social determinants of health. So one reason that Robert Wood Johnson kind of came back and is doing this again has to do, I believe, this is my interpretation, is the 2010 report happened. All of those recommendations went out. Then Robert Wood Johnson turned their eye to the Culture of Health initiative, which is really all about equity and social determinants. But it didn't do that before it really engaged nursing. And so I think the nursing group was looking for a way to make sure that nursing was involved in that bigger Culture of Health initiative. And this is one way to do that. Again, that's my interpretation of the sequence of events. My colleagues and I this year published an article, it's cited down there. It just came out not too long ago, where we sort of take apart all of what happened in the 2010 report, what the context is for how the Future of Nursing group is approaching social determinants of health and things like that. So if you want to, I mean, that's an article that gives a much more detailed background on that. Next. So the processes that are driving this version of this report, if you're not, well, first, more name changes, I guess, let's say that. The IOM is, what was the IOM is now the National Academy of Sciences, and EM is for the medicine branch of that. So that group was sponsored by Robert Wood Johnson Foundation to generate the report, meaning they were paid. The staff and resources of the national academies were, I guess, elicited to generate this report. In the process that the national academies use, there is public input required, but the options for input really vary quite widely. And are partly determined by the group and the specificities of the report that they're planning to generate. There's not a lot of transparency in the committee selection process. So this committee is an important committee. It's supposed to be independent from the sponsor, meaning it should not be influenced by the sponsoring or paying agency. And they should come up with independent recommendations that are, again, based heavily on evidence. But there are a lot of gaps in terms of how that selection process happens and who's selected to speak or present in some of those meetings. And there's just a lack of transparency around that. The discourse or the conversations are tightly controlled. Lots of closed meetings, who can speak, how long they can speak, what the process is to be able to speak. So there's a lot of control over who can ask questions. Not everyone can ask questions when you go to these public forums, which kind of blew my mind. So there's a lot of control over the conversation. In this process specifically, way more than the initial report, this process is addressing social determinants of health. Clearly a public health concern, and clearly, something that we thought we needed to watch and be a part of. So next. So we we're trying to think of how to engage with this group. How do we make sure that public health nurses' voices are in here this time? And there are a lot of reasons that we thought that was important, which you'll see. The Future of Nursing emphasis was launched in March 2019, and we wanted we tried to strategize at the mid-year meeting, the section mid-year meeting, which was also in March, like literally right before, like I think 2 weeks before the actual launch of the first public meeting of the Future of Nursing group. So we met with Dr. Georges Benjamin, who's the executive director. He's also a National Academy's member. And we asked him what his recommendations were for engaging with that group, not really being super familiar with how to do that. He gave us some of his thoughts, and we came up with some of our own and took some of his. And among the leadership team, we, at the time, how significant a concern this was kind of varied among the leadership team, but ultimately it was voted in to approve develop a strategy for how we're going to do this and what we would do. Next. So, these were some of our concerns that relate to the context in which this report is being developed. The approaches for achieving health equity. Our major concern, given who was on the committee in terms of representing nursing, which was not exclusively, but largely acute care kinds of people with those acute care kinds of backgrounds. Our concern was that downstream individual approaches that were consistent with the traditional healthcare system would sort of dominate the report. And that tackling social determinants has to be a huge role of whatever the recommendations are if we're going to get to health equity. There's no way around that. That how we think about social determinants of health really differs from the public health world or end of things versus what the US traditional healthcare system perspective is on social determinants. Now, you'll get an eye view of kind of what that means in a couple of slides. A major concern, or something we wanted to guard against happening basically in this report, was making sure that there wasn't a conflation of what are social determinants of health, which are things like racism, educational or housing opportunities, with the intrinsic individual characteristics of people, like race, education level, or homelessness. So those are different. If we focus only on the individual characteristics as things to fix, we will never, ever, ever get to the social determinants of health that are actually generating the problems within individuals. And so the concern of many on the section, myself included, was that that these two conceptualizations would not be distinct, and that there could be consequences for that. Next. So, so again, the issue, this is just a graphic that we used in a lot of our conversations with the Future of Nursing Committee as a group, and individuals when we talked with individuals. I think Brian was part of your opening session in this education conference, and this is straight out of Brian's article or blog. And so we took this and tried to show, try to educate more around what downstream approaches are, what upstream approaches are, for people who might not be thinking about those every single day like we do all the time. But a main concern here is if we only address social needs, like by largely screening people. Are you homeless? Yes, check. Okay, I'm going to refer you to the shelter. If that is the ceiling if that's the bar for addressing social determinants of health, our real concern was that that could actually do more harm for socially or economically disadvantaged groups who are already marginalized, and because then people think they're doing it. We're doing work in social determinants, but they're not, and it deflects sort of the energy and the time and the effort needed to really get upstream. So that's that's kind of the basis of our concern with that effort. Next. As I mentioned, historically, acute care nurses have a little more limited understanding of social determinants, and they were most represented on the Future of Nursing Committee. There were, however, some really well-known public health scholars on the committee who did their job, as far as I could tell, in terms of holding, kind of staying true to the idea of social determinants when there were question answer sessions and engagement in that way. And so we were very happy to see that the public health folks on the committee were doing their job. One of whom was David Williams. I don't know if any of you've read David. He's a Harvard professor. He knows, he knows this. He's written the book on social determinants pretty much. And so it was great to have him as part of this team, not our team, but the Future of Nursing Committee, in the discussions there. Next. So what we did was we developed a strategic plan. I don't know if the links in this work in the PDF, but if they don't, we'll fix them and get them to you. This is available. You can link to it in a Google document. Okay, there it is. So that's like a very long, like it's basically a diary entry. This is the diary of the public health nursing section, and you can see who we were writing letters to, what the main emphasis points of the letters would be, the people on the committee. That's great, Lindsay, if you can keep scrolling. We had the upcoming meetings planned out. We knew who in our section lived in that area and who was going to go to publicly speak. We mobilized them. There were Twitter chats that we were all over with our communications team. Some examples of tweets in there. You can take a look at this, the actual letters that we sent to some of the committee members, sort of outlining our concerns from the get-go. Long letters. We don't have any idea. Dr. Mary Wakefield was another, so we wrote one to David Williams, Mary Wakefield, and then Marcus Henderson. He's he's a new nurse, but he has some community experience, and I've actually forged quite a really great relationship with him. And then you have all of the comments. So at each of these meetings, there were public comment periods. We were invited, the section was invited to allow 2 minutes of testimony from the section at the launch meeting. We had literally a week to get this together. We found somebody, one of our members who lives in DC, works at Georgetown, and together we wrote the testimony or the script, and she went, and presented that. At the other, that's a huge, she's scrolling through, that's a huge bibliography there of all the citations that we use and the letters and our testimony and other things. And we tried to show them what the public health nurse intervention wheel was and what that looked like. And then more dialogue on Twitter, where we talked about the social determinants of health toolkit, which I'll talk about in a minute. So that's 34 pages of strategic planning, and there were three town halls, public town halls, just kind of like you see in a political town hall, sort of, where there were opportunities for people to sign up. So the speakers for Chicago, Philadelphia, and Seattle had already been selected, and we were not in that group anymore. No public health nursing was actually in that group. And so our way of getting our voice heard there was to make sure that we found a way into the public comment pool. And that meant getting there early, signing up, being one of the first to sign up, having our testimony ready. So Lisa and I, you can see in some of the pictures, Lisa and I flew to Chicago in June, and we presented, we each had 2 minutes. We each had 2 minutes of testimony that we could give. And we wrote ours to complement each other. So we tried to, we wanted to make sure that we would both be able to speak and that we went right after each other, and we were able to do that. And so kind of double our time. But we went and talked about, you can read the testimony, it's in the link. Talked about public health and tried to drive home some big points. In Philadelphia, we have section members who are part of the Nurse Family Partnership. We wrote testimony with them too, and they went and signed up, and our voices were there in that. And we have members in Seattle who, again, we wrote testimony with, and who went to the Seattle Town Hall. So we were like everywhere. At the town hall meetings, and our nurses and public health nurses were represented. We would just not be ignored, basically. Next. So as a result of that, and we have a pretty active Twitter group who were kind of cheering Lisa and I on in Chicago when we were talking, but we were the only nursing organization present at all 3 town halls because we mobilized the resources of our section and made sure that we were there. Later in 2019, November-ish, another sort of arm of, I don't know if it's an arm or it's a collaborating group with Robert Wood Johnson, took kind of everything they were learning on the committee about social determinants of health, or what we thought they were learning, and decided to publicize a toolkit, a social determinants of health toolkit. And the intentions around that were all very good in terms of helping nurses in acute care settings and everywhere address social determinants of health, quote unquote. When our section saw this and did a pretty thorough review of it, a lot of the concerns that we had for the committee discussions were actually sort of realized in the written toolkit. We again kind of got together, and what we first did was we tweeted some things out about what we saw as some of the deficits in the toolkit, asked the group if they planned to, told them we're happy to engage with you to talk about this. Didn't hear back. So we partnered with the CPHNO, other groups in the CPHNO. Public Health Nursing, our section led this effort though, and wrote a pretty robust response to what we saw as problems with the toolkit, which really, from our perspective, had the potential to perpetuate this idea that you can just really kind of easily solve the social determinants of health problem. And again, the people who are going to come out getting the bad end of that deal are the people who are already getting the bad end of that deal, in terms of, folks who are disadvantaged in one way or another. So that link should also work. And that's posted on the CPHNO website. And you can go in and read that. You can test that if you want, Lindsay, and just see if it does work. If the other one worked, it should. Yep. Okay. So we wrote an open letter to them, which they responded to, and asked to meet with us. And as of last month, we had about an hour long, I've had several sort of personal consultations with them, and we had an hour long meeting with people who generated the initial report, and talked through some of the concerns and our hope that many of the examples and possible shortcomings in that toolkit would be corrected, so that we didn't, in fact, see more adverse consequences for already at-risk groups. And as of right now, we are waiting for Robert Wood Johnson to offer a proposal for how they see us being involved in this, and that's to be determined. So we'll see. Next. So we're waiting to see, well, through this process, I guess I would say that we did have some, I think we got the point across that that public health nurses have some very specific expertise, and that we are needed. Our voices are needed in this report, and that there are very good reasons that they should be listening. And they did attend the Quad Council event, which last year it was still the Quad Council, in November 2019. And we talked with their group again there. And then I think I just talked about some more consultations that we just had in the last couple of months. Next. So these lay out our concerns. Most of them are kind of similar to the concerns of what's happening in the 2020-2030 report. One big thing that kind of showed up in this toolkit, though, that we felt like we needed to respond to was this whole idea. There was kind of language in the toolkit over and over again about how, for example, bedside nurses, I'm laughing at Susan's chat. Bedside nurses, go address the social determinants, like work with your communities, work with your community groups, your agencies. And a big question in our mind is, how are they going to do that? Like, are you asking them to volunteer their time? Because the last time I checked, there wasn't an FTE coverage for your average nurse working on an ortho floor to, to go and engage with the community somehow about meeting social determinants. So there seemed to be some real cognitive dissonance going on around what they're recommending, what they're saying, and really sort of the practicality, the reality of being able to do that. So we called that into question, and that's kind of a, whereas, let me just say, in public health nursing, although it's waned, over the last several years, that's part of public health nursing's job, is to do community relationship building and community organizing, and that's built in as part of the positions that not many, but some public health nurses have, and it's much less so in the acute care world. So next. Okay, so that's kind of where we stand with the future of nursing stuff. To be continued. They have delayed the release of the report into 2021 because of COVID. We continue to monitor all things future of nursing for that report. I keep getting called, sorry, I don't know why. So when COVID hit us all, and we thought about, like, what could we do and how can we organize and what do we need to say? And, we basically came up with this kind of table of people, being able to just enter into it, kind of what advocacy actions they were taking as part of the public health leadership group. Some of us got together and were very purposeful in what we were doing, like in writing some of the op-eds. The chair-elect and past chair, we published something in the Journal of Public Health Nursing, and others just started writing and talking to media and being interviewed and doing everything they could to get public health nursing out there. So I don't know if those links work necessarily, but and we don't have to test them right now, Lindsay, but I'll get this link to your group if you want it. So because within this table you can then link out to the actual op-eds or things to read. So that's part one of the table. As you can see, we were pretty engaged, and we had a lot of steam in March and April, and I think around May and June we started to kind of fade out just a little bit and need to back up and kind of refresh ourselves. So lots of commentaries in the news, lots of op-eds, etc. Lots of stuff going on there. Next, thanks. And these are just some titles about the advocacy, getting healthcare workers protective equipment. I wrote one with fellow section members, an equal opportunity virus in a nation of inequity, trying to bring attention to the fact that the virus was going to make the inequities visible and probably worse. And then if you haven't read our piece in the Journal of Public Health Nursing, I think that's open access. So everybody should be able to see it if you want to. Next. So there were a number of things happening around us at the time. I mean, everybody was scrambling basically to figure out what the priorities were, to figure out what do we ask Congress for, like what do we want to see in the CARES Act? What is it that we need from nursing? So we actually have 5 liaisons from the section who sit on the Nursing Community Coalition, who are engaged in all those calls and hear the issues and review the letters that get sent up the hill to the Hill and stuff like that. The first pass of the letters that were going out requesting funds for the CARES Act did not include public health strengthening investments in public health, much less public health nursing. So we worked with them to draft language that we lobbied pretty hard. We asked them to put into the letter something that would draw attention to public health nurses in particular. This is an excerpt of what made it into the letter that went to the speaker and other folks. So we were successful in actually working with them to do it and using evidence, bringing evidence to bear on why that was important. So now in those letters of requests from at least the NCC, public health nursing was a prominent feature. Next. And then we look to ANA. You know, ANA is writing, so the NCC is one thing, ANA is writing their own stuff about what they want. You know, of course, they were focused, rightly so, on PPE and needing to make sure that nurses had PPE, and that's absolutely on point, right? They needed to be focusing on that. But we asked, one concern that we had was that the CARES Act funds, when approved, would go to the states largely through the CDC. And so the state health departments would, or departments of health, would kind of decide how to spend that money and what professional group basically to invest in. Like who would be the case investigation leads, who would do all that, the contact tracing work, who had the skills and the know-how to do that, who should they hire? Should they be working to kind of reinvigorate the public health nurse workforce, or should we be hiring people who aren't public health nurses? So we wrote a letter to ANA. I wrote a letter to ANA asking that they encourage their state nursing associations to advocate for state departments of health using a substantial proportion of the federal emergency funds to replenish the losses to the public health nursing workforce. And at the end of my letter, I said, we're basically hoping for some support from the ANA for our colleagues in public health who are also on the front lines, where we desperately need more funding to make up for basically all the losses in the workforce that happened since 2008. So that was my plea to them. Next. And with some back and forth and some sort of contentious back and forth, this is what is on the website in their very public statement that that went to congressional representatives or as well. So we did get in there in terms of helping them craft this language and making sure that it's not just nursing, that it's public health nursing, because otherwise the image that comes into the heads of anyone is not necessarily public health nursing. So we saw that as that was a score to get some of that language in there. Next. Another thing we took part of was the occupational health and safety section reached out to us and asked if we wanted to sign on to a letter that they sent to the Secretary for Health and Human Services on the CDC guidance, which was completely insufficient to really protect essential workers. And while nurses are essential workers, and there are other essential workers who are have some advantages, many of the essential workers are, from minority and otherwise disadvantaged communities who really didn't have a lot of say in whether they go back to work in unsafe working conditions or not. So OHS led this fantastic letter. They did a great job writing it and linking it to so much evidence and so much of what was going on in the news at the time. I happily signed on. I really didn't play much of a part of writing that. It was perfect when it landed on our desk. And it's a great example of, how we partner with other sections within APHA to kind of get the work done. Next. Another thing that we did, so again, I'm going to ask you all to be kind of like, get into your chat box here. How many of you know or have listened to one or more of the webinars that are part of the COVID-19 conversations that APHA is putting out? Just say yes or no, I guess. So some not. Okay. So this was frankly brilliant and needed on the part of APHA, I would have to say, in terms of taking a role in this pandemic that really showcased this is public health. Like, public health is where this is landing, and to really kind of own the expertise that public health has. So they created, with the National Academy of Sciences, this COVID-19 conversations. And really early in the pandemic, they were the first ones to kind of make this available to everybody. You just register, you listen in, you can ask, I think you can ask questions on the chat. You get CEU credit for it. So it was a big deal. And one of the things that I saw, especially in the School of Nursing, was like people who work in acute care settings and aren't public health were like, they were all over email talking about this and sending it out. So this put a huge spotlight on public health in the healthcare community in general. And so every other week they would host an hour and a half kind of panel conversation. After about 5 of these or so, I began seeing a pattern, which we are seeing replicated on CNN and any other news outlet you want to name, where there really are no nurses speaking on these panels. And so I wrote a letter to Dr. Benjamin and basically said, hey, where are the nurses? And there are some areas here that I think you're going to probably have webinars about over the summer that, nurses are really critical to what happens here. 2 of those areas are school nurses and reopening, and inequities, like the inequities that are resulting from this. The nurses can talk about that. So I recommended a slate of school nurses, and they listened, And on August 12th, there was a panel on K through 12 reopening where Donna Mazik, I'm not sure I'm pronouncing her last name correctly, but she's the National Association of School Nurses chair or director or executive director. I'm not sure what her official title is, but she was part of the panel. And so that was good. And I don't think that that would have happened without our section pushing this. So that was one additional way that we were, trying to put public health nurses on the map, I guess. Next. There were also, the summer, right? The whole year, but the summer with more blatant racism, police violence. There were a lot of calls, every organization was trying to figure out what they wanted to say, where they wanted to stand, what was important to be said. APHA put out its own larger organization statement, and it's a great one from Georgia's Benjamin. It's a great statement, and that's on the website if you want to find it. The thing that I thought it missed, I didn't think that it really spoke to our nurses who weren't public health nurses. Like I can't actually remember what exactly about it off the top of my head, but when I looked at it, I thought we need something more explicit. We need a more explicit message to send to our colleagues that explains to them why we cannot just work from within the healthcare system and expect social justice to happen, or expect health equity to happen, or expect that some of our population groups aren't going to be murdered or treated unfairly in patterns that can't be ignored, right? So we wrote an addendum to this statement that really called out nurses in ways that probably wouldn't have happened with just the APHA call. The process for doing that was kind of tricky. I had to work with our government relations folks on that and how we get it out and how we could format it and how we could post it and just like all that stuff. So it lives predominantly in Twitter. That's kind of its location. But the one way we made sure it got in sort of to a living document was through the Nursing Community Coalition, our partners there. They had statements from all of their 63 member organizations who wanted to submit one. So we submitted our addendum in that way. I think that actually, I think I embedded URL links in the actual picture of the screenshot there. So Lindsay, can you hover your cursor over the Nursing Community Coalition one, like just that picture? Okay, it looks like there might be a link there. Can you see if that works? Awesome. Okay, so those work. So when we circulate those, you can go right to the actual document if you want to see it. Next. And most recently, we were never really able to kind of get our act together in terms of making anything a public coherent and evidence-based statement around the treatment in the border detention facilities. But this whole notion, all of the reports that the nurse Dawn Wooten reported, I think this was in September. I remember waking up on a Saturday and I was just sitting here at my desk and I thought, and I was reading about her and I was watching some videos of her and just what the cost was to her to report some of this. And I thought to myself, you know, if that were me or any of us, probably a letter from a nursing organization or just knowing that your nurse colleagues have your back right now would be very much appreciated. So I wrote her a letter, and I figured out how to thanking her for stepping forward and recognizing what a hard thing that is to do, and recognizing that she's probably literally putting her life in danger by doing that. And circulating that to all of our membership, because she has a GoFundMe page to help with her legal fees and things like that. And so I figured out how to route it to her through her lawyers. And I asked the leadership to vote on, you know, whether they approved of me sending this or not, and they did. And so I sent it, and literally within an hour, I got an email from her directly, just thanking me so much for, you know, for sending this letter. Like she said, I can't even tell you what this means to me. So I think we're going to have bigger things in store for kind of recognizing her next year at our hopefully in-person annual meeting. I want to do that, and so I'm going to be working on some plans for that next year. But she was very grateful, and that was a good thing to do. And that's up. That's a snapshot of the webpage, so it's up there if you want to read the letter. Next. This is coming up. This is a fantastic annual racism pre-conference session that anybody can attend. You can register. You don't have to register for APHA. You don't have to be a member. All folks can join this and be a part of this. I encourage you to get engaged. This is one way, right on the heels of this conference, to do that and start to talk to your colleagues who are working at the national level. This is going to be a fantastic pre-conference, and the group putting this together is phenomenal. There are also, if you happen to be someone who's registered and going to be attending the bigger conference, there are also some special sessions on disruptive practices that Public Health Nursing is sponsoring. So some of those prove to be real advocacy grounded kinds of presentations, and I think you might like those. So hope to see you there. I think this is gonna, I think this pre-conference is gonna test the limits of Zoom. And I mean like by volume. We've had hundreds and hundreds of people attend this, and I think this year we're advertising more broadly, and I think we'll see a lot more people there. So it could be a huge group. Next. All right. This brings me to the end of this, and like just 2020. That's all I have to say. I'm ready for a better 2021. We've been doing a lot of advocacy that I think hopefully will in some way benefit public health nurses nationwide, but those in our backyard here of North Carolina too. There are lots of pathways to become involved that I talked about at the beginning of the presentation and partner with us. I think reaching out to your colleagues in the PHN section when there are North Carolina things going on that you might need help with is a great idea. Don't hesitate to do that. We might not have the bandwidth to do it, but it doesn't mean you shouldn't try. And if we can, we certainly will. And in the future, what I'd like to do, this whole thing around ANA that I explained, I'd like us to find better ways to link to the state nurses associations, to link public health nursing section and or even our North Carolina section, all of you, more to the state nurses association. And the reason I say that is I think there was a lot of mobilization of the state nurses association when COVID hit. And again, if we would have had a closer kind of working relationship with them already going on, we might have been able to have public health nursing specific kind of things highlighted in different ways, but we didn't really have a lot of those relationships, and I couldn't make that happen through ANA, even though I wanted to. So I think that's a longer term plan that we should all kind of be thinking about and engaged in. So that's it for me. I'm sorry for droning on so long. Thank you for sticking with it. And I'd love any discussion or questions or thoughts or whatever if there's time.
So Sean, we did have one question that was dropped in the chat box by Dr. Little. Do you think the NCPHA PHN section can better collaborate or partner with APHA PHN? What are other state affiliate PHN sections doing? And I think you kind of just touched on that.
Mm-hmm. You know, there's not, I mean, so periodically, like Massachusetts, I remember in California, they're pretty active too in terms of public health nursing. And periodically they'll reach out to the section and say like, oh, this is happening in our state. Can you come and, you know, can we get some support for this? Can you sign a letter? Can you write a letter? Can you, you know, can you do other things? Can you make some phone calls? You know, can you have your members make phone calls? And so it can be used kind of as a network to mobilize people. And those are usually like short-term, very specific kind of things going on. And I think that's how state public health nurse associations have generally interacted with the section. But I definitely think there's space for more long-term strategic kinds of things that we could be doing together.
Thank you. I didn't see any other questions, just some comments. Thank you for your leadership. I do just want to let everyone know, I know we went a little long today, but I dropped the evaluation link so you can get your continuing professional development units, and I pinned it to the top. Please continue to be involved at both at the local and hopefully at the national level. I really think there's a lot of opportunities for partnership here. And I'm going to try to display the evaluation slide on the screen here for just a couple minutes. Let's see if we can make that work. You have any other comments, Sean?
No, it was just good. I wish I could have heard a little more from folks. Actually, you know, a conversation is good, and it's great. I feel very fortunate to be in North Carolina and have the group we have.
I concur.
Thank you, Lindsay, for everything you're doing too.
Well, thank you, everyone. Please see the instructions here on your slide. You'll note you have to attend all 4 sessions that the nursing section of NCPHA sponsored today to qualify for continuing professional development units. So the recorded sessions should be available on Monday. We will work to get all the slides and materials that you've seen both from Dr. Knight today and from the others sessions before posted to the webpage as quickly as possible. So thank you all.
Great. Thanks, everybody.
Bye.
Bye.